Hi, this is pharmacist Curtis Alexander. In this video, I'll be talking about cyclobenzaprine, also goes by the brand name Flexeril. We'll be talking about dosing, side effects, and at the end, I'm going to give you some of the more common questions I get specifically about the drug, give you my take on that. Don't forget, a lot of times I get asked as a pharmacist, what can I do outside of meds or surgery? I've got a free report in the link below. Just go to curtis-alexander.com and it's yours. So let's hop right into it. So Flexeril or cyclobenzaprine, what it does in your body, it's actually really similar to the tricyclic antidepressants. So amitriptyline, some of those old school antidepressants, what it does, you can get your actually nervous system can kind of start continuously firing on some of your voluntary muscles. And basically Flexeril goes in and blocks that. Now, what about the dosing? Because there's two different types of Flexeril now. We have extended release and immediate release. Normally you see the immediate release. And we'll start out, say, 5 milligrams up to 3 times a day. Some people do it scheduled, some people do it PRN. I always encourage people, if they're going to start it more towards the evening. See how you do, because it can kind of snow some people. But that's a typical starting dose. We make sure to get one of those doses at bedtime. With the immediate release, you can go all the way up to 10 milligrams 3 times a day. Again, I like to start people once a day at bedtime just to see how they do first. Then we can add more in if we want, but that's my personal take. The extended release is different. It comes in a 15 or 30 milligram strength. It's just once a day. So 15 milligrams once a day. It can go all the way up to 30 milligrams once a day. Now the downside of the ER, you can't use it in the elderly. Okay, that's one we want to avoid in the elderly, and I'll talk about why in a second. Now, whatever form of Flexeril you're using, ideally we want to keep it very short term. 2 to 3 days use would be ideal. What we normally see is people taking it longer term. At the high end, I'd like to limit use to no more than 2 to 3 weeks. Now, in some conditions, that's really hard to not go beyond that. Some people with multiple sclerosis, things like that, they can use it longer term. We don't like to, though. So that's ideal. Now, what about side effects? First of all, big warning here. The main side effects you're going to see with Flexeril are anticholinergic. And that comes back to the fact that it's very structurally similar to those old school antidepressants we were talking about. Well, what does anticholinergic mean? Well, essentially you're getting dizziness, drowsiness, confusion. You can get urinary retention. You can get constipation. And we get an increased fall risk, okay? Now, one of the interesting things, I'm going to go over some of the more common side effects, and you're going to see this big range of when it can happen, and we'll get into why. But so your main side effects you're going to see, again, anticholinergic, so dry mouth, anywhere from 6 to 32% of people, dizziness, anywhere from 3 to 11%, and this is what they found in studies, drowsiness, 1 to 39%. I always tell people, if you're going to take Flexeril, expect to get drowsy with it. That's almost how it works in your body. That, again, coming back to the dosing, that's why I like to start people at bedtime, see how they do, and then we can add more on. Because if it's snowing them, if it's knocking them out, they don't want to be taking it during the day when they're driving, trying to work, those sorts of things. Now, why this big range? Because the studies looked at IR, various doses, and then ER, various doses. In all of these, the lowest incidence of side effects was with the extended release formulation. Okay, the highest incidence was with the highest dose of the immediate release formulation. The immediate release formulation is very nice because you can get quicker onset, but it also comes with higher doses, a much higher risk of these side effects. So it's a trade-off with the ER and the IR, okay? Now, what about warnings? There's some specific things you want to keep in mind if you and your doctor decide Flexeril is an option. First of all, we see more side effects, again, with higher dosing, so we want to try to avoid that multiple daily dosing. So again, start once at bedtime, increase to multiple daily dose, and only if you need it. Older age, so greater than 65, anybody with liver problems, we're going to see more side effects. Eye problems, if you've had glaucoma, you want to be careful with this. Urinary hesitancy. Now, let's talk about some other things. One of the questions I will get is Flexeril, cyclobenzaprine, is it a painkiller? Is it a narcotic? No, it's not a painkiller. It's not a narcotic. It can relieve some pain, but it's definitely not a narcotic, okay? What about alcohol? This is one of those people will ask, well, can I have a drink with it? And a lot of medications, you can go, yeah, you can have a glass of wine. It's not a huge deal. Flexeril? No. It's a hard no. Don't drink alcohol with it, because look at your risk of side effects. Drowsiness, dizziness, those are big ones. Fall risk is a big one. So no alcohol. That's hard and fast on Flexeril. So hopefully that gives you a pretty good overview. Hopefully what I'd really like you to do, if you've taken Flexeril, if you know somebody who has, post it in the comments. Let me know. It helps me. I may not be able to respond to all the comments, but it helps me, and it helps other viewers see your experience with the medication. Very helpful. And I hope this video was helpful. Until the next one, I will see you. Thanks.